Next up in Better Health, we take an in-depth look at the intensive care unit and how it runs.
Well, we're taking care of critically unwell patients. Most of the patients that we've got here got a reason to be here. They're on life support, ventilator support, cardiocirculatory support. Some here are for monitoring after big operations, heart surgery, neurosurgical operations, liver resections. And then, as you can tell, I'm part of the AME retrieval service as well, so a big part of our work is aeromedical retrieval work. I guess what's really different and unique about ICU, that it's about teamwork, and I'm not just putting that out there, it's really, I think the hierarchies are pretty leveled, and it's not about one doctor giving orders and making the plans. It's really about the teamwork here in the ICU, and I guess everyone who's worked in the ICU can tell.
I'm Catherine Brooks. I'm the charge nurse of intensive care at Dunedin Hospital, and so I've been in this unit for approximately 20 years, and I think that's what makes this unit different to many other units, is that there's a core group of nurses who have been here for 20 plus years. Some have been over 30 years, and so that cultural wisdom just gets passed on to other generations of nurses. Intensive care unit nurse, they are primarily responsible for one patient, and so they need to assess and treat and care for every aspect of the patient. So whether the patient's getting enough food, whether they've got enough blood pressure, whether their kidneys are working, whether their liver's working, and so they need to know the inside and the outside and the context of the patient. And that's the main role, is to make sure that all of their body systems are as good as we can get them, and that the family is managing with this episode of acute illness. We're really lucky here in Dunedin in that we have a general ICU, so we have patients across the lifespan from a few weeks old through to people who are in their 90s. And we get people after traumatic injury, so after accidents. We get people who are medically unwell with infections or breathing problems, and we get people who have had major surgery so that we can keep monitoring them in the at-risk period. So we even get women who are pregnant when they've got complications of pregnancy. So we get everybody who's unwell, and it means that the nurses get exposure to all sorts of unwell people and people throughout the lifespan, and that is what makes us keep coming back. And that is different to other bigger ICUs, because often they're specialised, whereas we're generalist, and that's what we enjoy. We run the aeromedical retrieval service out of this ICU, so the staff who fly out in the helicopter have actually come off the floor in the ICU, and we pretty much retrieve patients from Waitaki South. So we've got the largest geographical area of any retrieval service, but with 10% of the population. We also get people off cruise ships as well, so we get international travellers, and they're quite fun to look after as well. We've just had a patient that got picked up from Fiordland, and he and his wife took an identical cruise a year later just to come back and say thank you for the care that he received a year ago, which is incredible. It's so affirming that they wanted to come back and do that.
I think Dunedin ICU is a pretty unique place to be, really. It's the nurses have a great spirit here, and just the ethics that everyone's got in the unit here is outstanding. I've worked in different places, as you can tell. I haven't been raised in Dunedin, so it's a good, despite the fact that it's busy sometimes, it's always good to come to work here and feel the spirit.